Hello, hi everybody. My name is Bernie Pothia from UMass Global, and today we're gonna look at the week 5 patient teaching tool on Haldol. This is nursing 641 pharmacology with Dr. Willis. So why Haldol is being used? Haldol is being used to manage every symptoms of schizophrenia, including delusion and hallucinations. Women in Mawa, 2003 found that Haldol can be used to treat the manifestation of a psychotic disorder, control verbal utterance and tics of Tourette disorders in adults and children, and treat several behavior disorders among children with explosive hyperexcitability. The drug is also used to cure hyperactivity in children, such as poor frustration tolerance, mood lability, aggressivity, and difficulty sustain attention. The mechanisms of action. Although it's considered as a first generation, typically antipsychotic haloperidol, it works by preventing the brain's dopamine D2 receptors from functioning. When 72% of dopamine receptors are inhibited, this medication works at the best. Not only does allopurinol block the D2 receptors, which is a dopamine, but it also blocks noradrenergic, cholinergic, and histaminergic receptors. Blocking those receptors has been linked to several unfavorable medication effects. Haldol and side effects. Haldol side effects are mild and always go away by themselves. They occurred in 1 or 2 over 100%. There are things a person can handle without the help of a doctor unless certain effects persist. The most common side effects include dry mouth, increased saliva, constipation, increased sexual desires, and decreased sexual ability in men, missed menstrual period, headache, dizziness, mood change, and nervousness. According to Women in Marat study in 2023, Haldol can also cause agitation, restlessness, slow movement of body parts, blank facial expression, insomnia, vomiting, nausea, heartburn, and diarrhea, loss of appetite, blurred vision, and breast enlargement. So if you have another one of those symptoms, you need to see your doctor immediately. The information for the patient's population. First, we're going to look at age. Haldol are different side effects for children and adolescents compared to adults, which involves hyperactivity in children and various behavioral issues like aggressiveness in adolescents. The treatment for this is 0.25 to 0.5 milligram of Haldol administered, administered orally from 1 to 4 hours in 2 to 3 equal divided doses. In adult metabolisms, Haldol doses differently because of changes in the body function, Individual with side effects associated with schizophrenia or psychosis should be take 0.5 to 2 milligram of Haldol dosage orally, administered 3 times daily. Elderly patient should use the lowest effective dose for the shortest flexible period due to age-related lungs or heart problem. Now we're going to look at the culture side. So different background may influence the patient perception of the treatment and willingness to adhere to adult dosage. This required an understanding of various cultural aspects to tailor a treatment plan in relation to patients' belief and preference. Now we're going to look at the education level. An individual with a high education level may have a high level of health literacy. Therefore, understanding patients' level of education is vital for reducing misunderstanding of potential side effects, ensuring medication compliance, and providing clear instructions. Now, let's look at on-label and off-label use of Haldol. On-label use refers to using a drug for the same indication, dose, mode of administration, patient group, and composition without deviation from the approved FDA label. The off-label use of atypical antipsychotic is the practice of prescribing a medication for a purpose other than the one for which the FDA has approved it. It is known as off-label drug use because the drug is being taken in a manner not specific on its package inserted. This practice is known as off-label. When taken off-label, acute agitation, the dosage for acute agitation for off-label is 0.5 to 10 milligram given in 1 to 4 hours. Off-label use, also palliative care, use Haldol off-label. So we're going to look at the off-label Haldol use for each treatment indication in palliative care. In palliative care, off-label prescribing indication a deficiency of FDA-approved drug intended for. So Haldol use in palliative care off-label for delirium, anxiety, nausea, vomiting, and insomnia. And the dosage was usually 0.5 milligram to 1 milligram. And this is my reference. Thank you. Any question, please let me know.